Hi, I'm Dr. Mache Seibel, editor of My Menopause magazine. I've just come back from the annual meeting of the American Society for Reproductive Medicine right here in Boston, Massachusetts. I took that opportunity to interview a number of my colleagues from around the world on their latest research. Here's one of those videos now. Well, let me begin by asking you to just state your name.
I'm Diane Shepperson-Mills, and I'm the director of the Endometriosis and Fertility Clinic in the UK, and I also chair the Endometriosis She Trust UK charity in England.
Well, I just heard at the annual meeting of the American Society for Reproductive Medicine, I heard this delightful young woman speak about nutrition in a way that I think is very resonating for anybody, and in particular women suffering from certain ailments. And she agreed to talk with me about nutrition and the pain associated with endometriosis and ways that what you eat could impact how you feel. And I wonder if you might address that just a little bit, if you would.
Yes, indeed. Well, endometriosis, as we know, is in 1 in 10 women. Worldwide, we think 176 million women have endometriosis, and it is an inflammatory condition. The very fact that the womb lining material is growing on other organs of the body within the peritoneal cavity, so on the bladder, the bowel, the ovary, the uterus, it's giving off proteins and making its own estrogen, so the peritoneal fluid that's bathing those organs has an inflammatory characteristic which triggers the pain. I had endometriosis and severe pain, and it's very frightening. It's very frightening.
So you're saying that the endometriosis in relationship to the fluids that are naturally within the body
Yes.
are in women with endometriosis in an inflamed environment that is triggering the pain and exacerbating the problem.
Yes.
And certain foods or things that you eat could make it better.
Yes, well, the very fact that the endometriosis is seeding itself on the healthy tissue and growing in is triggering pain. If it's very deep infiltrating endometriosis, so it's like an iceberg, then you're getting a lot more pain because it's affecting more nerves. And if you've got ovarian cysts that are rupturing and all the matter from that cyst is hitting the bowel and the bladder and causing inflammation, you've got the implants themselves are producing 2 proteins, and they produce their own estrogen. So this tissue is supposed to stay inside the uterus. It's supposed to be inside the womb for the baby to grow in. But we don't know why it migrates around the body. But when you're getting all this inflammation and pain, there are ways you can look at your diet and eat foods that are reducing inflammation in the body and also helping your immune system. Because your immune system, the white blood cells, are a bit like computer Pac-Men. They're going round, gobbling up all the detritus and mess and the dead cells. And if you're trying to help them with the nutrients they need, we know macrophages are dependent on vitamin B6 and zinc, so we know there are certain nutrients we need to eat. We know that glutathione peroxidase, which helps stop free radical damage and damaging at the tissue, that is dependent on selenium. So if we can try and eat a diet that's rich in the nutrients that your immune system need and that reduce inflammation, like the good quality, cleaned of pesticide fish oils.
What foods now? You're saying the clean of pesticide fish oils.
Yes.
What other foods have the selenium in it? And
selenium, 2 Brazil nuts a day and some broccoli. If you're after B6, you've got some fruit and vegetables and green leafy vegetables. And zinc is nuts and seeds, a little bit of red meat, some fish.
You talked a bit about hummus and other foods.
Yes, hummus and avocados. I mean, I tell everyone to have a handful of nuts and seeds every day. Some people can't eat seeds, some people can't eat nuts, they have the other. But they're rich in the oils, the proteins and the zinc that will help your immune system, and the oils are anti-inflammatory. We know that women with endometriosis, they're producing more prostaglandin PGE2, which is like getting red chili on your nose.
It's a hormone that makes pain and contractions and so forth.
Absolutely. In fact, they inject PGE2 to cause abortions because it contracts the uterus. And the uterus and the bowel muscle are made of smooth muscle, and magnesium will help relax smooth muscle if it's tense and in a spasm.
How can a woman get magnesium in her diet?
Well, you can eat lots of green leafy vegetables. Magnesium's high in green leafy vegetables and bananas. But you can go to your GP and ask for a red cell magnesium blood test to see if your levels are low. You can get a white cell zinc test. You can get your B6 levels tested. So your GP can check. They often just check B12 and iron, but they can check levels of other vitamins and minerals as well if you ask them to.
So if you're a woman suffering from endometriosis, talk to your doctor, check your levels of B6, B12, and magnesium, and eat the foods that were just talked about. It'll help reduce your pain and also keep you healthy.
Yes, and I would also add a good tablespoon of berries every day, because they contain proanthocyanidins, which are anti-inflammatory. So you can have the berries with yogurt for breakfast, you can make them a smoothie with a banana, you can have them with your turkey or chicken as a side, or you can have them as a dessert with some creme fraiche.
Sounds delicious.
Or sorbet.
Thank you very much.
Thank you.